Millions of people across the country cast their ballots in the 2022 midterm elections. Some votes are still being counted, and certain races remain too close to call on the day after Election Day. Today, with the insights of three expert political analysts, we'll explore what Tuesday's results mean for governing in 2023 and for healthcare and hospitals. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly with AHA Communications. On today's podcast, Lisa Kidder Hrobsky, AHA's Senior Vice President of Federal Relations, Advocacy, and Political Affairs, leads a discussion with two veteran political consultants. They examine key results of the House and Senate races and what their impact will mean for the next Congress. This podcast is a condensed version of a webinar recorded at 2 p.m. Eastern Time on November 9th. Let's join Lisa and her guests.
Thank you for joining us today as we try to digest what happened last night, or maybe what didn't happen last night when it comes to the election. I am joined today by two veteran political consultants, one on the Democrat side and one on the Republican side, who are going to run through, again, what we think happened last night and try to prognosticate what that might mean for healthcare going forward this year and then into 2024 when we start looking at the presidential election, which now isn't too far away. We all know that the House was controlled by the Democrats yesterday. 220 to 212 with 3 vacant seats, so a slim majority for the House Democrats. Right now, we are in really close control for the House of Representatives for the Republicans. I think that the prediction that there would be a red wave or a pink wave really obviously didn't come through. We know that there are additional incumbents that have been defeated. We saw Representative Sean Patrick Mahoney is an additional one. We have 5 incumbents defeated. The reason Sean Patrick Mahoney stands out to all of us right now is he was the head of the DCCC, which is the House fundraising arm for the Democrats. He went out and raised all the money and campaigned for all the House Democrats. So that was a really big blow for the Democrats to lose. But again, want to show you where we think we are. The numbers I have seen right now are 204 for the Republicans and 175 for the Democrats. But again, the House has not been called. We think that this could be days while we're waiting for some of these really tight elections to come through. But again, no one's claimed victory in the House. And as we look at this Senate slide, you will see we are very much in the same place. As of noon, this is still accurate. They did call one additional Senate race in Wisconsin for Senator Ron Johnson. He held on to his seat. That was a really tight one. So currently we are waiting for 3 additional seats. We are waiting for Arizona, Nevada, and then Georgia. You may have just seen that they did say there will be a runoff December 6th. So we will not know control of the Senate in all likelihood till at least December 6th. So again, a lot happening on our plate right now as we try to figure out who's actually going to control the House and the Senate and what it might mean for us in healthcare and for a nation in general. But let me introduce our 2 speakers. We are thrilled to have David Bockorny and Dave Leiter with us today. Some of you may know them. They have been in DC for a very long time, and both of them have actually worked with AHA for a long time as well. And we are lucky to have them this afternoon talking with us. David Bockorny is the chairman and CEO of the Bockorny Group, which is a bipartisan group in Washington, D.C. that does political consulting and strategizing. Dave has been in Washington for a very long time. I don't want to put you at ease when I say that, Dave, but for a long time. He has worked for the Reagan administration, and he now has a vast amount of contacts in town on primarily the Republican side, but he also has Republican contacts on the Senate, on the House, with the members, with the staff, with the administration. You kind of name it, and Dave knows them. And he's been a real asset to AHA over the years. And then David Leiter will be the Democrat side, although they promise not to fight too much Republican versus Democrat. But David Leiter is here to sort of get the Republican perspective. And Dave has also been in DC for a long time and held numerous jobs. Currently, he is president and CEO of the Plurus Strategies, which is a firm that he runs. But David's had numerous jobs of importance here in town. He was John Kerry's chief of staff for 7 years. He worked in the Clinton-Gore administration, and he also worked for the Department of Energy as a presidential appointee. So lots of great work by both of these, and I'm thrilled to have them. So I'll start off by asking you both the same question, and I'll start with you, David Bockorny. Honestly, what was the biggest surprise for you of the night?
Well, so Lisa, thank you. A couple just quick things. You've got the map of the world behind you, and then I see you have Idaho, which is really the center of the center of the world. I'm in Sioux Falls, South Dakota today, so hopefully, we're kind of in that same part of the country, where we had a pretty good night here last night in Red State, South Dakota. So I think suffice it to say that a little bit of it is, I think Republicans generally may have gotten ahead of ourselves. I think we sort of started to believe our own press releases, if you will. Again, it was, working for President Reagan. I mean, when he saw a big pile of horse poop, he would always say, well, there must be a pony in here somewhere. But again, I mean, I think, the biggest surprise was a big shock. Even if you didn't think it was going to be a red wave, which I didn't, I was predicting logically 24 seat gain for House Republicans. My sort of upside was 27, and then, sort of anything north of that would be kind of start of the wave, theory. It's not going to be 24. I think if you look at where I think we will land, and again, to your point, there's a lot of votes to be counted still. The New York Times was actually reporting this morning, and they've done a pretty good job of looking at the House races. They're sort of landing somewhere around 224 at the end of the day for House Republicans. Some other news sites have it a little bit lower, 219, 220. And then there are some rumors that again, maybe the majority still could be in question. But again, if I had to predict today, I think it's going to be somewhere around that 224, and House Republicans will be in the majority. So that's a huge surprise. And again, the other, I guess I would say just really quickly, a couple of other observations, and one being a surprise. Number of the House Republican candidates who won, they weren't necessarily the MAGA Donald Trump, even though I have a lot of things I can talk about in terms of the Trump shadow on this election, this midterm election. But interestingly, if the majority actually flips, it's going to be because of New York State, New Jersey, potentially, looking at, a pretty decent showing in California, South Texas with a Hispanic seat, South Florida with some, moderate Republicans, which kind of sprinkled in with some conservatives that did win, may produce the House Republican majority, which is going to complicate a speakership for Kevin McCarthy even more if that comes to be. So again, I'll stop there. I know we got a lot of material to cover, but that was a big surprise in terms of how we may get to that 223, 224 at the end of the day.
Great. And David, same question for you. Other than your maybe excitement over the night, what was your biggest surprise?
Well, like Dave, as he goes to red country, I came to Rhode Island and Massachusetts, real blue country. So I'm talking to you from Massachusetts this afternoon, and I got to say here, one of the surprises was New England. As the last I looked, we went into this election not having a Republican member of the House, and it looks like that's going to remain the same. And I think most people would have thought Maine, maybe one of the New Hampshire seats, maybe Rhode Island, even maybe a Connecticut seat. So, again, I think the big surprise was the headwinds that it felt. I think to all of us, I was quite pessimistic myself. I was viewing a wave coming, at least on the House side, particularly. And with all that seemed to be in favor, the headwinds the Republicans had going into this election, out of power, the history of the out of party in a midterm doing really well, Biden's unfavorables being so high, obviously inflation being a big issue, and the Republicans did, I think, a really good job of making crime a central issue as well. But as I know, it felt to me as if Democrats were trying to use the abortion rights issue mainly to change the subject, to get off inflation. But it resonated with people, I think, voters. It wasn't just Kansas. You look at the state ballots, there's a number of ballots issues that seem to show that abortion rights, even in Kentucky, is resonating. I think democracy helped. I think most of all, the quality of the candidates, maybe. And all of these are sort of cumulative. I'm sort of reminded of a quote, because I was in the United States Senate in 1980 as a young staffer when the minority leader, Bob Dole, woke up after the November 1980 elections and realized he was going to be majority leader. And he always did have a good one-liner or two. And he said, if I had known that we were going to win control of the Senate, we would have run some better candidates. Uh, and I think in this particular case, Mitch McConnell was trying to do that. And I think this was one of the Trump factors. I think they got, and it's not to say that the Democrats ran the perfect candidate in every state too. I can think of one where they might have won last night if they had put a better candidate up, more moderate candidate. But I think it's clear that the Trump factor and some of the candidates that he was promoting, I think really hurt the Republicans' chances for even better, bigger gains.
Yeah, I think people are going to be talking about that for a while now. Dave, I know it's hard to sort of talk about this since we don't know a lot, but when you look at the election and the outcome that we think we're going to see, what does this mean for the Republican Party sort of in general? Like, what do you think that the implications for them might be as they look at what they didn't get, the wave last night?
Well, that's a great question, Lisa. I mean, again, I think there's multiple answers to that. I mean, I think there's questions about what does it mean for Kevin McCarthy if he's the speaker, and how does he try to govern? And I've got some thoughts about that. It also, again, it means still with, the Senate, not yet determined. Is Mitch McConnell going to be the offensive coordinator, as he likes to say, or is he going to remain the defensive coordinator? Again, the Senate is a place where, as we see, most of the time with the filibuster, you can, you can find a way to stop the worst things. But most recently, when Democrats controlled all three, the House, Senate, and the White House, reconciliation became a pretty powerful tool for governing. Again, that's not likely to happen with McCarthy as speaker if that turns out to be the case. I mean, that kills the reconciliation process. And then I guess, the sort of the third factor in all of this is what does it mean for the future? And I actually do think that, maybe this is a tough lesson for Republicans last night, but to that point, I think, already we're seeing, I think this may be the impetus for, the difference between being a potentially Trump-led party pretty clearly into the next primary season in 2024. And already, I mean, my phone's been blowing up today about, what does this mean for, DeSantis? The New York Post had a front page cover that showed his picture, the governor's picture, with the headline, "The Future 2024." Glenn Youngkin, the governor of Virginia, will be in that mix. And so I think it's going to start a process. And then I guess I would say too, with regard to, there's more diversity in that. I think, again, there's going to be more diversity in the House on the Republican side, in a very closely divided, House. And so I think that's going to really change what I would have expected the kind of the messaging out of the House of Representatives to really be. So again, I think it'll be everything from Kevin McCarthy relying more on his committee chairs, if that's the way it turns out, to really, kind of keep the lid on things and sort of sort out all of the family fights at that level before it has to get to the speaker level. That's easier said than done. But again, I think there's going to be a lot of, kind of nuances that it's going to be pretty important for the future Republican Party that we start to figure these things out. I've got great confidence in Leader McConnell. So, either way, I mean, I think the Senate will be, again, it'll be a little more rambunctious probably than it's been, in the last couple of years on the Republican side. But I think if Democrats try to move, too fast, too far left, with divided government, I think Leader McConnell will be well positioned to kind of keep a lid on all that.
Gotcha. And I will go back to you and David both towards the end and ask you about your thoughts about DeSantis, who you brought up, Governor DeSantis, and sort of get your thoughts about what you're thinking in the future. So hold that thought, the thoughts you might have on him.
Will do.
David, same question for the Democrats. What does this election mean to them? How does it hold for the progressives, and how do you think they did? And what do you think the party's thinking now that they had a pretty good night, really? Like, what do you think this means to them?
Yeah, I think they're just relieved not to be the ones that are lamenting about where were our failures. So there's some sense of relief generally that we didn't mess this thing up too badly because of the history of what happens in a midterm. So I think there's always a period in which you have to assess, what do we do right? What do we do wrong? Who are we not reaching out to that we need to be more inclusive of if we're going to be a majority party or we're going to regain control? I think, on the Senate side, it feels to me like Senator Schumer probably was never in jeopardy anyway. His leadership team stays pretty much in place. I do think when you start to look toward 2024, you got to look at some of the elections. And I think immediately of Manchin, who's up for reelection, and others that are going to be in really tough states. We got a Montana reelection, we got Ohio. So that's going to factor in about how does the Democrats, even in the Senate, even with the more progressive Warners and Bernie Sanders, they're going to have to be somewhat conscious of their colleagues if they want to be back in the majority or remain in the majority if they are fortunate enough to keep it this time. So that's going to be a factor. On the House side, we don't know yet what's going to happen with leadership. I think probably most Democrats are going to, if someone wants to have a vote of who has the toughest job in all of Washington, I think we know it will be Speaker McCarthy. With the margins he's going to have, it's just going to be, it's so challenging a job to begin with. And I think if Speaker Pelosi decides that she's not going to stick around and retire, I think you're going to see, I think Democrats got to wonder about what's the new leadership team going to look like? I mean, she was such a masterful, skillful legislator. Her ability to gather the votes that she needed and put together coalitions and also raised a lot of money for Democrats, et cetera. I think that's going to be something that if she steps out and the leadership team, I suspect, would change dramatically. The Democrats are going to have to figure that piece out first.
If I could just jump in and add from a Republican perspective, what we think also occurred last night is I think the results, David, gave the Biden team a little bit more of a lifeline than maybe where they were a week ago. And again, thinking about 2024 presidential, I think the Biden team has got to be feeling pretty good about sort of where things landed today.
Yeah. So since you brought that up, Dave, now why don't we talk about, so if you're looking at the Biden administration, and then we saw that former President Trump made an announcement that he's going to make an announcement on November 15th. Are we looking at a Biden-Trump run again, or what are your thoughts on? I know DeSantis had a great night in Florida, so people are looking at possible DeSantis running. What are your guys' thoughts on? Are we going to see the same race that we saw just a few years ago? Where are you on that election on 2024?
Sure, and again, I think conventionally, if you would have asked me last week, I would have said it would be very unlikely that we could get the kind of Republican presidential wannabes into a race that could really be viable against former President Trump and the Trump machine. And again, if you look at Republican base primary voters, you would have to say that the former President Trump's got a huge advantage, and so it's going to take something pretty significant to be able to get in the ring. And again, I think that kind of points to, with the results of last night, I mean, some of the really, kind of superstars on the Republican side last night were governors. You look at, DeSantis in Florida, Kemp in Georgia, Abbott in Texas, DeWine in Ohio, and then Kristi Noem here in South Dakota, for example. I mean, there's 5 governors. And again, I don't know that all of them will run, and then you throw the governor of Virginia in too, Youngkin, who could raise lots of money. He's got personal wealth. So you start to think about it. It's like, okay, now thinking about Iowa, New Hampshire, South Carolina. Tim Scott, the senator from South Carolina. It's like there may be a pathway that some of those potential presidential contenders. Last night's results may be enough to really get them to think about, now is the time. And again, I would just say, to kind of, really put a sharp point on that. Last night, 75% of voters, exit polls said the nation was on the wrong track, right track. 75% dissatisfied with the direction the country's going in. Inflation, the number one issue, highest in 40 years. And the president at 42% approval. And in spite of all of that, swing voters and moderate Democrats, being that dissatisfied, were not willing to give Republicans a chance as the alternative with the Trump shadow, the Trump factor. I think it had a huge impact on sort of the outcome in a lot of those races. So again, thinking about where do Republican donors go, where do Republican operatives go, I think this is going to be, this is going to be an interesting next 3 or 4 months to kind of see where that all, ends up. I will say though, the big hurdle is, the Trump voters are, I mean, the more the former president, kind of feels like a victim or looks like a victim, the more rabid, Trump fans and voters become. So it's a tall order on our side. And again, I don't think it's impossible, but I think it's going to take a Herculean effort from somebody. Maybe DeSantis, could be the likely one.
David, what are your thoughts on the Democrat side?
Well, I guess I subscribe to the conventional wisdom that if Trump is the nominee or is in there and it appears that Trump will be the nominee, then Biden is likely to, if all things provide for him to be able to run again, health-wise and everything else, that he would run. I think he'd feel compelled to do that. I think he also feels like I beat this guy once, I can beat him again. I think if it becomes DeSantis, that may change the dynamic. It may feel like the generational thing is coming into play, and maybe it is time. And we could see what happens in the House leadership too. I do think there's definitely on the Democratic side, a pent up, and probably in both sides, there's always a pent up feeling of it's time for a new generation of leadership. So I think there's obviously two governors have been very, outspoken, it feels like, in trying to lay the path for candidacy, California and New Jersey in particular. But then you have former governors like North Carolina who, when you're a former governor and you're just out of office, what else would you do but run for president? So I think you'll see, I think what will happen will be people will not want to be the first candidate probably in the race, but ultimately someone will have to challenge Harris, assuming that the vice president is going to be a candidate if Biden steps out. So you probably want to wait and hopefully say, gee, I'll be the second or third person into this race. I don't want to be number one.
So I do want to get to some healthcare specific questions, but David, I want to follow up on a couple of things that you've referenced, and you've talked about the changing of the guard in Democratic leadership. Can you talk a little bit more about on the House side when we're looking at if the House does flip to Republican, which I think most people think it probably will, maybe not a huge gain for the Republicans, but can you talk about what happens to Speaker Pelosi and the leaders who have been with her now for quite a while? What do you think the young leaders might be? Do you think that's going to happen? Sort of give us your thoughts on what a momentous change that might be in the House.
Yeah, I think, if no one, I mean, we all, or most of us in Washington anyway, but maybe a good part of America saw the interview the other night with Speaker Pelosi, and she was asked very directly whether she had just even made a decision about what she'd do, and she kind of dodged that one a little, but she did indicate that what happened to her husband, the attack on her husband, would play a role in whatever decision she makes. And I think at first glance, everyone said, well, that's a gracious way out. That means she's not running. And then some started to say, well, wait a minute, the fight for democracy. And with the showing that, I think that was yesterday. So now with the showing that Democrats have made, at least I think there's less like probably sentiment that she has to go, we need a whole new team. The big difference will be that team has extraordinary, as I said earlier, experience, not just her, but Steny Hoyer in the number 2 slot as well, and Clyburn. It'll be difficult to put together a team, but I think there's a team in waiting that's ready to go with the congressman from New York, Jeffries, a congresswoman from Massachusetts, Clark, and then Pete Aguilar from California probably are the likely, there's been talk of other people who might get into the mix, but that feels like the way it would go.
Okay. Well, let me ask you guys a couple of healthcare questions. What do you think the election might mean for hospitals, the healthcare field in general? I mean, if there is a divided government, what is your sense of anything getting done in healthcare, or maybe anything getting done at all? But as AHA and hospitals and health systems are looking towards 2023, 2024, sort of what is your sense from maybe House Republicans, David, and what they might be thinking, or just, David Leiter, on a divided government?
Lisa, that's a good question. I mean, again, I think one of the things it means is I don't think we're going to see anything extreme. So, again, sort of whatever the attacks, might be on Medicare, or we're going to fix Social Security, Medicare, trust funds. I mean, I think that's going to be very hard to do, and quite frankly, even to message around. So, we'll see where that goes. But a couple of things I think related to what we could do. One is, again, in House Republican ranks, the Florida congressional delegation, not just because of DeSantis being the governor, but I mean, that's going to be a very, very potent congressional delegation. Again, the chair of the Ways and Means Committee with a lot of jurisdiction over, healthcare that hospitals care about, not yet resolved, but I think in my mind, it probably tilts a little bit now towards, Congressman Buchanan from Florida, just because of Florida, just being, kind of the one red wave in, Republican circles came out of Florida with 4 new congressional seats and a very diverse delegation. And then, I don't know, just kind of, thinking, beyond that, I do suspect that if there's anything that's going to kind of materialize or, proactively, I would not be shocked to see some House Republicans now wanting to reach across the aisle to the problem solvers, David, which is a group that, on paper, they exist, a bipartisan group of moderate Republicans, moderate Democrats. And they were not very effective, quite frankly, in the last Congress because they were kind of flanked on the left by progressives. They were flanked on the right by conservative Republicans, and they didn't have much role in, successfully governing. I think, quite frankly, that both the Democrats and Republicans, I mean, if they really want to move product, especially in, like healthcare, putting together some coalitions like that, could be kind of a new paradigm that we haven't seen, for a long time. So again, it may require us to kind of start thinking differently than we've thought, the last, 4 to 6 years. I mean, given kind of the gridlock. So I'm curious about that. I'm not ready to predict that's going to happen, but I think, Lisa, to your question, if we can do things incrementally, it'll be, in putting together kind of factions like that.
As polarized as this country is and the parties are, I agree with Dave. I think that wasn't so long ago we had the Democrats calling for Medicare for all and the Republicans calling for repeal of Obamacare. I think those are off the table now. I think a lot of what's going to happen is actually going to be the table is going to be set by what happens in the lame duck, frankly. If we move an omnibus bill, it's a vehicle for the pay-go relief, a lot of things that we would want to get done for hospitals. And I even think other things could ride on it that are important to the healthcare system, like telehealth, pandemic preparedness, behavioral health. Many of those are bipartisan, and the Finance Committee and the Help Committee, for example, particularly on the Senate side, have been working on measures. Now, they won't be as robust as Democrats would have wanted, but I think those are the sort of things that could be worked on on a bipartisan basis. And if that's done now, that would be a good thing, I think, because I worry that if we don't, and I think this is where Speaker McCarthy will have to balance his desire to be speaker and securing the votes to be speaker with the temptation to, on the policy side, to satisfy his caucus. And if his caucus is saying, don't cut any deals now, kick this all over to next year, I think that's a prescription for disaster for the Republicans, because if we get to February and we have a government shutdown over abortion or FBI defunding and some really, which the Democrats have had to worry about, those riders that became issues. If McCarthy is having to deal with those, and we've got a threat of a government shutdown followed by the debt limit, maybe a month or two later, then again another threat. I think it sets it up for that may give Biden the leverage he needs to be the high moral ground in the upcoming election.
Okay, well, David, you hit on a lot of issues that we are currently talking about here at AHA, and as did you, Dave. We're worried about the Medicare trust fund and it going broke in a few years. And do you look to Medicare and hospitals to pay for that? And then the deficit and the deficit reduction and raising the debt limit, is there going to be offsets required? But it sounds like you both are saying in a divided government, there's probably not going to be an easy agreement on how to fix any of those. So we either one might be safe, or two, there might be apocalypse and the government shuts down and nobody's safe. So I'm not certain I like that answer necessarily. Well, I'm going to give you guys a couple questions that are coming in. Let's see. So question, and either of you feel free to answer this. Let's see. What does it mean for the lame duck and the grants that are currently in the appropriations budget? So let's see if I can figure out what they're referring to.
Does that mean directed congressional spending, Lisa?
I'm going to take it to mean that. Does this mean for the lame duck and the grants? So I think that's what it means, is sort of the congressional earmarks that they hadn't been doing and they're now doing again. I don't know. Are House Republicans going to allow those to keep going forward, Dave? Do you know?
Again, that's an open question, debated again when we thought there was going to be more of a conservative red wave. I mean, I think there was some concern that they could go, they could vanish again. But again, now the makeup of the House Republican Conference, a lot of those new freshman members are going to come from moderate districts. Not from the Northeast, not from New England, David, but certainly places like New York, New Jersey. So I would think again the House Republican leadership are not going to be able to knee jerk on a lot of these things. I mean, I think they're going to have to thread the needle. So a vote in the conference. I mean, right now, it'd be hard to predict where it may land. I mean, again, I think it'll require transparency, but I would not be shocked to see some continuation of an earmark policy.
Do either of you want to put in any type of final guess on what you think the final House and Senate numbers might be? You have until December 6th to re-guess and clarify, but just to give you both a final chance.
You want me to go first, huh?
Yeah.
Well, from what I understand, I think the Democrats are feeling pretty good about Arizona. Kelly should be reelected there. The question is Nevada. If they get two of those, then Georgia, they could have the runoff in December, but it won't make a difference. The Democrats will end up, even if they lost Georgia, in that runoff would be 50-50, similar to what it is today. So, it could, I think everyone was of the mind initially that this thing was a 52-52 one way or the other. And we're going to find out it's a little narrower than that. It's 51 or it's 50-50. There are people who think that Georgia is actually that Warnock is advantaged here. It is Georgia, and I didn't believe it last time when we won. Democrats won 2 Senate seats in a runoff, so I guess anything is possible. In the House, I think we're looking at if I had to guess, it would be on the low end of what we would call a normal midterm, maybe 20-seat pickup or something like that.
Great, thanks.
Yeah, Lisa, I tend to agree with David. I do think it is going to come down to Georgia, though. If we have Georgia participants, I think the political world will be looking at Georgia here in the next several weeks. Again, Adam Laxalt, I think ran a good campaign in Nevada, helped by a good governor's race out there. So I think he'll prevail. He's been up about 2 to 3 points, most of the night and the day. So that's a pretty good gap. I'm not as optimistic about Arizona from a Republican perspective, David. So again, if Arizona stays Democratic, Nevada flips Republican, we're right on the cusp of whatever happens in Georgia. Beyond that, I'll just speculate a little bit. I don't think I think we're past the point that Joe Manchin would be courted to switch parties. But I don't think it's impossible that Senator Sinema would not, be beyond the pale of switching parties. She's going to be looking at a hugely difficult Arizona primary. She's in cycle in 2024. The Republican Senate leadership, loves her, and I think will show a lot of love in the next number of weeks and months. And that would shock the world if we actually got someone like that to come over to our caucus. So
I have a question, but I actually would almost rather in on that because that's such a great point, Dave, about cinema that we get people talking. But I will ask one more question that says, are you surprised by the margin of the Kemp victory versus the need for the Senate runoff in Georgia? And then both of you on this one, how will the timing of the Georgia runoff affect the serious negotiations of the lame duck, i.e., will the Republicans hold off until 12/7 before budging on the year-end package? Which that's a great question.
Absolutely. I think we're going to see a lot of spinning of wheels until we know, the outcome of Georgia. Again, for a lot of reasons. A lot of the leverage, moves over to the Republican side, Lisa, not just, on policy, but it becomes, leverage on the Biden administration's nominations if we happen to have a Supreme Court vacancy. So having some of those, tools in your toolbox, it's really important to kind of see where it lands. And conversely, I mean, if Democrats win Georgia, it probably then it really falls to I think Kevin McCarthy. How much does he want to clear out before he becomes speaker, or how much does he want to fight over when he becomes speaker? So
I would just add, I think I would guess that he wants to clear it out. The question is, can he clear it out and still be named, be elected speaker? That's the challenge. I think I've talked to the senior appropriation staff, most senior appropriation staff, and they tell me they have solid commitments. It's not surprising. We got some Republican senators who are retiring, including the ranking member and Senator Blunt and others who have a big interest in doing this final appropriation. So you can be sure Shelby, but it goes beyond that. It goes to Murkowski and Collins, to Graham even. They've all committed they want to get this done, and they have interest in getting this done, including those earmarks. So it's hard to predict because it all, I think, would reside on. I think most of this is going to come down to how the McCarthy deals with that issue.
Great. Okay, well, I will let you both go, but I can't thank you enough for making time today. I know you're both probably tired and would rather be sleeping after staying up late all night last night. But thank you both for your insights, and I know that we'll be turning to you in the days and weeks ahead to get more information as it continues to unfold. But thank you both, Dave and David, for doing this today. And with that, I am happy to conclude this presentation. Thank you so much for making time to hear about, again, the post-election update and sort of the uncertainty around that. We'll obviously keep you up to date as we can on the implications for hospitals and health systems. But have a great day. And again, thanks so much for joining.